Well, COVID infections dropped this past week locally, and health experts say that big surge they expected during the holiday season didn't happen.
As our Sammy Salina explains, this comes the same week that the Minnesota Department of Health decided to close up their state-run testing sites.
Fortunately, this winter so far, we haven't seen a major spike.
Dr. Hannah Lickson is the Hennepin Healthcare Medical Director of the Internal Medicine Clinic.
I think that the COVID hospitalization numbers really have plateaued.
According to the latest Minnesota Department of Health numbers, only 378 COVID patients were hospitalized Monday. That's the lowest since mid-October. Infections also dropped, but health officials say the good news seems to be making people lazy, keeping up with vaccinations.
We haven't had phenomenal vaccination rates in Minnesota with the newest booster, the bivalent booster.
In fact, only 15% of eligible Americans have received the latest version of the shot.
It's really frustrating because we know that being fully vaccinated is the best protection that people can have against severe illness, hospitalization, and death.
As a goal of getting more people vaccinated, an FDA committee voted unanimously to simplify vaccination by recommending shots to have the same formula to target the viral strain. They're also considering having an annual COVID vaccination schedule, sort of like the annual flu shot.
I would expect that we're going to continue needing these to stay safe.
Dr. Lickson isn't too worried about the Department of Health testing sites closing this week. She says there's enough availability of tests.
Yeah, as long as they know how to access it. And that's our job, to make sure that people can reliably find a way to get tested if they're feeling sick.
Health experts still urge you to get tested if you think you might have COVID, and there's still free at-home tests you can get through the state, although that program is in its last round of orders. We have resources for that on KARE11.com. Julie, Lauren.